do they know how much time you've used?
Just because
There's a lot to go in there.
And always the most passionate people I work with are the people who work in the diabetes field, and particularly the DPP. Even during the study, it just seemed like people got that this is going to make a difference, and how hard I work and how passionate I am about it is going to contribute to that difference that it's making. And I see that still today. It amazes me. And even people who are coming in now, I think that they come to this meeting and see that they're part of this big group of people that is contributing to making a big difference. And I just love being around that.
One of the most effective things that we did at Cow Creek, and we incorporated with the other two tribes, was we got our tribal leaders involved. A lot of our tribal leaders are in the medical field, so it was very interesting to them and for them to come on and be our champions. The second, right behind them, was the medical staff, getting them on board early. We didn't really realize how important this was right away, but we quickly figured that out, and we tried to be able to grow the program in the first few months. Was everybody understanding what the program was and where we were taking it.
And we set up relationships within the community. We set up relationships with who you work with for the labs within our hospital. Even though we work for Search, they're different departments. And then also just getting the buy-ins from our tribal council, which is the Sitka Tribes of Alaska.
One of the things that really helped us at the beginning in creating our diabetes prevention program was we developed an advisory team that comprised of providers and even a council member and people that were going to be doing the actual DPP. And we tried to lay the foundation for what we wanted and the outcomes that we wanted. And it was really good to have experienced people that were at Cherokee Nation and then the new staff to come together to really develop something.
In addition to our core team members, we've also have had the pleasure of working with providers, nurses, phlebotomists, our laboratory department personnel, medical records, billing department, and outside of our organization and our clinic, we had the pleasure of working with community partners. And all of these folks in the community have contributed to developing, helping us implement, and even evaluating our programs.
Some partnerships that we have within our program and within our clinic, we're fortunate to have our public health nurses right in there with us, our dental is right in there with us, our behavioral health programs are in there. So we utilize the public health end of things quite a bit. We work with them a lot on some of their programming that they do, walk runs, things that they're already doing so that we don't have to reinvent the wheel, but we can certainly be a presence there. And that's tremendous because they're a powerful force in our community.
We incorporated the tribal elders and the leaders and the medical staff in the building of the campaign. So we first came in and we explained to them, we showed them the original DPP study. They were right on board, not exactly sure how we were going to implement it at our site, but we knew that if we build a campaign around it, that we were going to be able to probably market it and be able to have folks identify with us. And so we knew enough to know that that would probably be a really important first step. So fiscally, one of the things in laying the foundation that we wanted to assure right away was that we would have enough resources to be able to run the program. We knew we weren't going to receive enough funding, so we went to the tribe, and again, by having the champions and the tribal leaders, they were able to provide in-kind staff, furniture, equipment, some of the things that maybe up front, the capital that we didn't have, so that we could be able to use our grant funding to provide educator, some more of the program supplies and things like that we needed. In laying the foundation, one of the most important things we found was to have our champions help us with our campaign. So we developed a slogan, and we called it "The Results Are In." And this was a huge success. Our tribe was very supportive of it and was able to hook us up with our marketing expert up in Portland. And she just plastered this all over the state. And we had phone calls and folks writing us. We had journalists contacting us, asking us if we would do interviews, if we would come and do presentations on how it is that the tribes are preventing diabetes. And in one of the articles, it was just awesome. It read, if you want to know how to prevent diabetes, you go to the Indian tribes.